Good morning. Welcome back to this workshop on the collectives, organized by the Collective for Political Determinants of Health. This is the second day of our workshop, but for those of you who may just be joining us, my name is Katrine Storing and I co-direct the collective together with Sakiko Fukuda-Parr. This morning we are going to have a session on innovation, medical products and equity with 4 excellent speakers. This is a hybrid workshop and we are here in Oslo, but I'd like to inform those of you online that we also welcome your participation. You can participate either by raising your hand, in which case we may call on you to ask your question via video and audio, or if you prefer, you can choose to write your question in the Q&A function, and it may be read out by our chair. And that brings me on to introducing our chair, which I'm very delighted to do. He is Antoine de Bengy Puyvallée, and he is a PhD candidate in our university here in Oslo in international relations. And his research focuses on global cooperation to manage disease outbreaks. Most recently, of course, COVID-19, and he'll be presenting on that work later on today. But specifically, he studies global public-private partnerships as a new form of hybrid international organizations and investigates how public-private partnerships acquire and consolidate authority in global governance over time. Antoine has been also the coordinator of the independent panel on global governance for health that preceded this collective, as well as central in organizing this conference. So please, Antoine.
Thank you, Katrine, and good morning, everyone. I'm really happy to chair this excellent panel. And I thought to get us started, I would just quote a speech from Dr. Tedros, the Director General from the World Health Organization, from September 2021. Globally, 5.5 billion vaccine doses have now been administered, but 80% have been administered in high and upper middle-income countries. Not a single low-income country has reached their vaccination target. That's not their fault. We've heard excuses from manufacturers in some high-income countries about how low-income countries can't absorb vaccines. But because manufacturers have prioritized or been legally obliged to fulfill bilateral deals with rich countries willing to pay top dollar, low-income countries have been deprived of tools to protect their people. There has been a lot of talk about vaccine equity, but too little action. High-income countries have promised to donate more than 1 billion doses, but less than 50% of those have materialized. Manufacturers have promised to prioritize COVAX and low-income countries, but as we know, this has not been the case. We don't want any more promises. We just want the vaccines. All right. I think a couple of years later, the urgency that led Dr. Tedros to denounce what he called the vaccine appetite has been very much forgotten by at least some powerful players. Instead, we hear a lot talking about the largest vaccination rollout in history, a tremendous success that has reduced the gap between rich and poor countries like we've never seen before in history. And right now, the future of how we govern future pandemic preparedness efforts is being negotiated in multiple fora. For instance, through a WHO pandemic treaty, a new financing mechanism, new global and regional institutions, and also revisiting some rules for intellectual property rights. And so that's what this panel is about, is to look and dive into the current efforts that are being made to govern pandemic preparedness and response. And I'm really thrilled to have this stellar panel from our collective to try to make sense of what's happening now. So let me introduce them briefly. First of all, Deborah Gleeson. She's an associate professor of health practice and management at Trobe University in Australia. And her research cuts across health policy and health law. She's particularly interested in studying the implication of international trade agreements for public health, pharmaceutical policy, and access to medicine. Online, we have Suerie Moon, who's professor of practice and international relations at the Graduate Institute of Geneva, which she co-directs. She wrote extensively on access to medicine, outbreak preparedness and response, trade, investment, and intellectual property rules. On my right, I have Felix Stein, a good colleague of mine, with whom I worked with for the past 3 years on a research project on public-private cooperation in pandemic preparedness and response. Felix is an economic anthropologist and is just starting a new position at the University of Amsterdam. He has worked on management consultants, innovative financing mechanism, and is about to start a large project on the role of reparations in global development. And finally, Sakiko Fukuda-Parr, who will be with us very briefly in a short time, is a professor of international affairs at the New School in New York City. She calls herself a development economist and research course across global governance and international political economy. She has written about human rights, global health, knowledge production, and is currently working on decolonization. And she co-directs the collective on the political determinants of health, since she has also been involved in the original report from 2013. All right, so that was my introduction, but now with no further ado, I would like to invite Deborah Gleeson to hold her talk.
How do I put the slides up? Sorry.
Can we get some help for the slides, please?
Oh, here we are. Okay.
Thank you.
All right. Thank you so much for inviting me along to speak at this wonderful workshop. It's a great pleasure to be here. So the topic I'm going to speak about today is the World Health Organization Pandemic Agreement and access to pandemic-related products. So this is work in progress that I'm doing with some colleagues in Australia, Belinda Townsend, Bridget Tenney, James Scheibner and Diane Nicol. So I'll just briefly introduce the WHO Pandemic Agreement for those who don't know very much about it. I'll talk a little bit about the method that we're using for our policy analysis of the agreement and its negotiations. And then I'll focus on the preliminary findings in terms of analysing the proposed measures in 4 areas that are relevant to pandemic-related products, and then just make some concluding points. Oops. So the pandemic agreement has really arisen out of widespread acknowledgement that things went very badly during the pandemic in a range of different areas where we would have liked to see a lot more solidarity between countries. And one of those areas, not the only area, is access to COVID-19 health products and technologies. So the pandemic agreement is one of a number of different initiatives to try and introduce new rules, new ways of cooperating to inform better pandemic prevention, preparedness and response. So it's really a key opportunity to design better systems, and it sits alongside amendments to the international health regulations, which are being negotiated at the same time. But a major problem has been that there's been sort of a loss of momentum as the COVID-19 emergency is receding into the background and other crises are taking over. And there's also a wide gap between the alignment of interests between developed and developing countries. And we're seeing some of the same issues, the same politics that played out during the pandemic now getting in the way of progress on the provisions of the pandemic agreement. So the aim of this study that I'm speaking about today is to analyse the measures that have been proposed for the pandemic agreement, specifically those to address equitable access to health products and technologies for pandemics, and to look at their prospects for success. So for this policy analysis, we're using Walton Gilson's health policy triangle framework to analyse the proposed measures, the dynamics of the negotiations and their prospects for success. And the part of the policy analysis that I'll talk about today is the policy content part of the analysis. So I'm going to look at 3 successive drafts of the pandemic agreement, the 0 draft, which was released in February 2023, the Intergovernmental Negotiating Body's Bureau's text from June last year, and then the first negotiating text, which was released in October, so just a few months ago. And we'll be looking at other official documents from the WHO website as well. So what I'll do today is to just take you through the types of rules that have been proposed for the pandemic agreement and how those rules have fared through these 3 successive drafts of the agreement, because the trajectory has been quite interesting in terms of what's happened with those. So this is just a pictorial of the health policy triangle. So you can see the part I'm speaking about today is the policy content analysis, but we'll also be looking at the context, the process for the negotiations, and the actors that are involved and how they've, each of those has influenced the negotiations. So to start off our analysis, we looked at what have academic experts proposed that should be in the pandemic agreement to achieve more equitable access to pandemic countermeasures. So, and then we mapped those recommendations to the topics that are covered in the pandemic accord. So this is kind of, I guess, setting the bar in terms of what would we hope would be in this agreement once it's finally concluded. So things like the research and development area, alternative incentive and funding mechanisms, more geographically distributed research and development, transparency about research and development funding, conditions placed on publicly funded research and development. In terms of technology transfer, we'd want to see both voluntary and mandatory measures to enable sharing of intellectual property, time-limited intellectual property waivers, and so on. So we used this to sort of analyse what was in the agreement. So the first area I'll look at is the research and development provisions in the pandemic treaty. So in the zero draft, and just to give you a bit of background about each of these drafts, the zero draft was not actually a negotiating text, but more of a compilation of the proposals that different countries had made for what should be in the pandemic treaty. So a bit of a wish list of what the countries, the WHO member states wanted to see in there. Because there were such differing opinions on the zero draft, the intergovernmental negotiating body came up with the Bureau's text, which was intended to set out some options that might be more feasible, you know, some areas where countries could maybe make some trade-offs between different areas. But there was widespread unhappiness about the Bureau's text, and I'll show you the reasons for some of that unhappiness as we go through it. And then the negotiating text didn't so much build on the Bureau's text, but went back to a lot of what was in the zero draft, which had actually been removed or watered down in the zero draft. So in terms of the research and development provisions, so we saw some really good proposals in the zero draft. So proposals around cooperating on capacity building for research and development, increased transparency about public funding, terms and conditions placed on public funding to accelerate access, and so on. But the Bureau's text, because the countries were far apart in terms of their views on these provisions, the Bureau's text had a significant weakening of the legal language. So it was already weak in the zero draft. So we had very sort of aspirational provisions, language like endeavour to include terms and conditions, and the legal language was weakened even further. So we saw the insertion of phrases like in accordance with national laws or as appropriate. So basically you can do whatever you want. We saw things weakened even further from from things that might actually make a difference to more, sharing and collaboration rather than solid commitments. And the commitments on terms and conditions placed on public R&D funding were removed from the Bureau's text. Fortunately, the negotiating text, when that was released in October, reinserted some of the original provisions from the zero draft, but some of the weak language remained, and there were still no commitments on terms and conditions placed on public R&D funding. So that seems to be a lost opportunity now. That seems to have vanished from the agenda for the pandemic agreement. In terms of the transfer of technology and know-how, again, the zero draft had some really positive commitments. So commitments to promote or incentivise technology transfer. It didn't go as far as mandating technology transfer, but there was some good language in there. commitments on strengthening coordination on intellectual property and trade, collaboration on equitable and affordable access, and importantly, in the event of a pandemic, taking appropriate measures to support time-bound waivers of intellectual property rights. So this was a key issue during the pandemic that we didn't get right. At the World Trade Organization, there were negotiations to try and negotiate a waiver of intellectual property rights that would see more widespread manufacturing of pandemic countermeasures. But after 20 months of negotiations, we came out of that with a very, very weak, basically a tweak to the World Trade Organization's TRIPS agreement, which hasn't been used in practice at all since it was agreed in June 2022. So it's good to see that there's some language, there was some language in the Zero draft around negotiating these types of waivers that would kick in future pandemics. But in terms of the Bureau's text, so this was one of the most controversial parts of the Pandemic Agreement Zero text. The Bureau's text set out two different options. So option A was similar to what was proposed in the Zero draft, actually a little bit strengthened in terms of the text. But option 11B watered down that text significantly and really emphasised voluntary engagement with pharmaceutical corporations instead of providing levers for governments to influence the transfer of technology. And there was the option put on the table to remove the text on suspending the application of intellectual property rights through time-bound waivers. Fortunately, the negotiating text largely reverts to the Zero draft in this area. And it actually includes an even better provision, which is around sharing undisclosed information, which was a huge issue during the pandemic. If we can't get manufacturers to share undisclosed information, then it's very difficult for manufacturers in low and middle income countries to manufacture vaccines, even if they have the access to the information in the patent. So it's good to see that this has gone back towards the Zero draft, but I think that the fact that there was the option put on the table in the Bureau's draft in the middle of last year to remove this area from the agreement means that its prospects for success are fairly weak, that it will end up in the final agreement. I won't go through the other two areas in detail, but it follows the same sort of pattern in that some positive things have been proposed for the pandemic agreement in the Zero draft. The Bureau's text waters it down, presents different options, and then the negotiating text has gone back to some of the better proposals from the Zero draft, but retains some of the weaker language and does drop some things that we would have liked to see in the agreement. On the access and benefit sharing side of things, the Zero draft proposed the establishment of a multilateral access and benefit sharing system, which would involve real-time access by the World Health Organization to 20% of production, 10% which would be provided to low and middle income countries as donations and 10% as affordable prices. But the Bureau's text provided an option of just having government-funded purchase agreements instead, or kind of best efforts to donate or sell products to developing countries. So the negotiating text, fortunately, has gone back to this idea of providing WHO with a proportion of products. I mean, we could argue that 20% of production is not very much for low-income countries, but at least that proposal has remained in the text for now. But I'm not sure that it's likely to survive the negotiations. So just to conclude, the Zero draft targets many of the issues that have been recommended by experts, but it's mostly framed in non-binding voluntary language. So while it may make some difference, there isn't a lot in there that will give countries a huge amount of leverage, particularly to change the practice of the private sector. The Bureau's text, while it's not, a lot of that text hasn't been carried forward in the negotiations, it really tells us a lot about the key areas of disagreement. It removes some commitments altogether. The really important one that hasn't come back in is the terms and conditions on public R&D funding. It winds back some legally binding commitments that were proposed. It presents options to remove some commitments, and it waters down the language throughout to more aspirational and voluntary language. So, what do we, think about the prospects for success? I think it's a moving feast at the moment, and one of the good things that's happened in the last few months is there has been the emergence of a group for equity established between the low-income countries, which may mean that the prospects are improved. But I think that the chances of coming up with a strong agreement, particularly by May this year, are fairly slim. Thank you very much.
Thank you so much, Deborah. I'd like now to invite Suerie Moon, who's joining us online, to talk about her presentation.
Excellent. Good morning to everyone in Oslo. I regret that I'm not able to be there with you in person. It's an amazing gathering of minds and hearts, I should say, but really an honor to be here with all of you. Let me just put up on the screen my slides, and Antoine, you can let me know. Can you see them okay? Let's see. How's that? Do you see the slides?
We're all good.
Okay, excellent. Okay, wonderful. So good morning, everyone. I wanted to first thank the organizers for the invitation, and also all of my colleagues in the collective. It's been a real pleasure to participate in this group, and my special thanks to Katrini and to Sakiko for your leadership of our group, which I think has been a fantastic source of inspiration for me. I also wanted to flag that some of the snapshots of research that I'll be sharing in my talk are not just my own, as is often the case, and to thank a number of my colleagues whose names you can see at the bottom of the slide. Too many actually to include on the slide, but we have entire research teams from 2 projects who've contributed to some of the data that I will be sharing. Last but not least, before diving in, I just wanted to take a moment to echo Sakiko's words about Professor Susan Sell, whose very unfortunate and untimely recent passing, I think, was a shock to many of us who work on these issues. And to say that in addition to Sakiko's very moving comments yesterday, that one of the things that I think Susan did was not only to inspire people like me and to continue to inform my students. I assign her work in, I think, almost every class I teach. But she really was a trailblazer, I think, in the field of international relations. She opened up space for us to pursue, at the time, what I'm sure were atypical topics in the field, such as intellectual property rights, which are not really, were not considered for a long time the core of IR. And I think she really helped to open up the field for people like me who are interested in a broader range of topics. So we miss you, Susan, and we will miss you. Thank you for all of your contributions. So let me now turn to the topic of my talk. And you can see already, I think, the conclusions and the title on the screen, which is about rising multipolarity, and I'll focus on the promise and pitfalls of what I call a decentralizing global health system, in particular for pandemic-related products. And there are really just 3 key ideas that I'd like to leave you with today, and I'll go through each of them in turn. So the first is that we do have a situation of rising multipolarity, by which I mean a broader distribution of power across countries in the international system, and that's reflected in the issue of pandemic products, in growing capacity in the global south, in particular for innovation and production of health technologies. The second key idea is that for a number of reasons, including rising multipolarity, we have a decentralizing global health system, kind of a centrifugal trend or moment, if you will. But it's not only because of rising capacity. I think the decolonization movement has contributed significantly to this, as well as a loss of trust in a top-down global health system, much of which is concentrated in Geneva. Not all, but much of which. And what are the promises and the pitfalls of these two developments? So that's really where I'd like to spend a bit of time now. And let's turn to the first point in rising multipolarity. One of the, I think, best data points that reflect growing capacity in the Global South for health technology innovation is the increasing number of clinical trials that are actually run in the Global South. So this image comes from a report that we published last year, and the article came out, I think, just in November, if I remember well. You can see the reference at the bottom of the slide. And what you can see here is that clinical trials, which are the most expensive and of course a necessary stage for health product development, the number and the proportion happening in low and middle income countries versus in high income countries has been growing quite dramatically over the last 30 years. So if you look at this pie chart on the left, you can see over a 30-year period, 1 out of 5 trials were in LMICs, so a system that was and continues to be very much dominated by high-income country research. But what you see is this incredible growth from 5% of all trials in the year 2000 to almost 1/3, 28% in the year 2020. And you can see this reflected. You have total trials. Here, the blue are those in high-income countries, and the reddish mauve are those in low and middle income countries. And from just in the last 10 years, we've seen a 375% increase. This is really incredible, and I think not widely appreciated enough. So this growing capacity was happening prior to COVID, but COVID, I think, really hit the accelerator on this trend. So one piece of data I think that reflects this is what happened with COVID-19 vaccine research and development. So we had about 371 vaccines in development as of 2022, 50 of which were approved. And if we look at where the earlier stage preclinical trials were happening and where the later stage clinical trials were happening, you can see a large proportion were happening in low and middle income countries. So 55 versus 39%. In the last column in the table here, you see partnerships between high and low middle income countries. And for clinical, a similar proportion, 53 and 41%. So again, higher than what you saw in the previous slide. When you look at where clinical trials were happening across the world, you can see here the top 10 trial locations. And you can see here on the map, indeed, where trials were happening, a very, very global phenomenon. So many, many different countries participating, and certainly not only those in the global north. And so again, I think a trend that has perhaps not been widely recognized enough that has important implications for where we're going. In terms of who supplied vaccine doses, this is from a study that's currently still under review, but the preprint has been released. You can see here that you still have supply dominated by a few large multinationals. So here you have total number of doses supplied by Pfizer. Here's the Oxford AstraZeneca vaccine. Those are the two in the lead. You can also see which countries, broken down by income group, which countries received those vaccines. And so indeed, a much greater capacity among some of the traditional suppliers. But what I think is less well recognized is what you see here in terms of the role of Chinese suppliers. And I should clarify, by the way, these are exports. So this excludes domestic supply. We don't include here, for example, Chinese supply within the country, nor do we include Indian supply within the country. This is all exports. So contributions to global well, basically to international supply. So you can see here that Chinese suppliers played a quite significant role. And here you have some of the other Western suppliers, Janssen and Novavax. And then in this last column, a group of suppliers from developers and suppliers from largely middle income countries. So for example, Bharat Biotech is from India. Abdallah and Soberana too are from Cuba. And you can see the volumes that were exported are relatively small, largely in their respective regions, but a fair number of companies and potentially a growing role for future health crises as well as for day-to-day supply. So the key point that I wanted to raise with that data is that you do have growing capacity, not only for production, but also for innovation. And this is something that I think is overall promising for greater equity. You have at the same time the second trend of a decentralizing global health system. And I flagged that one of the reasons for this may be rising multipolarity. And if you look at this slide here from the same study, what you can see here is across high income, upper middle income, low income, lower middle income and low income groups. So we've again divided these by income group. The proportion, so this is not absolute volume, but this is the proportion of supply coming from different channels. And what you can see is that for most countries, high income countries, they relied primarily on bilateral sources or regional. This is really the European Union that's reflected here. You have some data that's unknown. If you look at upper middle income countries, again, primarily bilateral. Unknown, this is really China. So again, domestic suppliers and lower middle income countries, again, primarily bilateral sources in the first year. You see COVAX beginning to play a more important role by the middle of 2021. And you heard Antoine's quote reminding us of what was happening in 2021, the quote from Dr. Tedros. And you can see COVAX does play an important role. That role increases. It becomes more important in 2022 when especially the high income countries are decreasing in their vaccine procurement as supply and demand has already largely been satisfied. And I think what this graphic shows is both of the trends that I was mentioning earlier, this growing capacity in some of the middle income countries to supply their own needs as well as to export. That's reflected in part in these middle two bars. And also, despite the important role that COVAX played, I think disillusionment and disappointment that it came late, it was relatively small. And at the end of the day, you can see there's an income gradient that the countries that relied on COVAX are largely low income with some lower middle income and much less reliance among upper middle income countries. What you also see in terms of decentralization, here's just one trend that reflects this decentralization, is this growing proliferation of national or regional institutions rather than more and more of a buildup of centralized global institutions. And one of the ways in which we see this is new institutions for pandemic R&D. So prior to COVID, I would say the global kind of pandemic R&D system, if you will, was dominated by two major players. You had the United States with the most developed national biosecurity R&D system and the creation of CEPI in 2017 that has been the main global player. You have, of course, a number of other countries, but playing a smaller role. Since COVID-19 began, you've had the launch of a number of new institutions at the European Union level through an institution called HERA, the strengthening of national institutions in countries like Indonesia, Indonesia and others, the creation of at the African Union, a new R&D biomedical research institution based in Rwanda, in Japan, something quite similar to the European Union and US systems, again, a national institution dedicated to biosecurity or pandemic R&D and others. So what you can see here is this move to set up regional or national institutions and not necessarily to build up one new global initiative. CEPI still remains, of course, a very important player, but I think this proliferation flags both the possibilities as well as indeed some of the pitfalls of these trends that we're seeing. So let me turn now to what I see as the promise and the pitfalls of these trends. So first is certainly a broader distribution of power, which hopefully will lead indeed to more equitable global health outcomes in the future. At the same time, you have the risk of competition, redundancy, and conflict between actors as you have a growing number of actors. Again, on the promising side, with regionalization, you have governance closer to the ground. I remember Usman Mushtaq mentioned this yesterday in the opening session. But at the same time, pitfalls with this, and I think Sakiko mentioned that regional solutions are not panaceas. You have inequalities, you have inequities within regions too. And certainly superpowers, regional superpowers that can tilt the balance in their favor. I do think that overall, on balance, these recent developments do raise the possibility of more equitable innovation and access to pandemic products and other products in the future. I think this growing capacity is very promising. But one of the big risks that we currently face is a rocky transition in terms of financing, leadership, and responsibility, because we're shifting away from a global health system that has been primarily financed and governed by about 8 to 10 countries and foundations, and a couple of foundations, who have also often taken strong leadership roles, who have taken responsibility for providing a number of global public goods. And it's unclear which countries, for example, among some of the middle income countries, will step up and fill some of those roles. And one illustration of this challenge is if we look at neglected disease research and development, you can see here total funding over the last 10 years. Most of this money, this green bar on the bottom, is coming from public institutions in high-income countries. You have a little bit from multilateral, you have foundations, philanthropic sources here in light blue. From public low and middle income countries such as India or South Africa, which are the major contributors here, this is this yellow, small yellow bar here. And you can see it's even been shrinking in recent years. And so if we want to realize some of the promise and some of the potential of this multipolarity and growing capacity that we see for issues like neglected diseases, I think we're going to need to see a much bigger proportion of financing and other kinds of burdens for providing global public goods taken on by these rising powers. So let me close with just a few reflections. From my perspective, global governance is more needed than ever in a decentralizing system for a number of reasons. We need, of course, coherence across a more fragmented system. We still have truly global challenges where adding up regional solutions may not be enough. So pandemics, climate change, AMR, and we still have equity concerns. We want to improve equity in a world that remains highly unequal across regions. So in the same way that within a single country, if you have high inequality, you want to rebalance that inequality through redistribution within the country. I think there is still a strong need at the global level to try to achieve more equity through redistribution and rebalancing of power. This means that we still need to pay attention to global governance. We still need to pay attention to improving the quality of global governance processes and institutions to make them more transparent, inclusive, and accountable. This is more important than ever. And at the same time, while I recognize multipolarity may make global governance less unequal, I think this is a hugely important and positive development. The risks of polarization, conflict, and leadership gaps are major, and I think we've seen this manifesting itself in the security sector over the last, just over the last few years. Let me end, however, on an optimistic and positive note, which is that health, I think, so far has been resilient, not immune, but resilient to rising geopolitical divides. And one of the reasons for that, in my view, is that health does remain a universal value. It does remain an area where cooperation can be somewhat depoliticized compared to some other areas, such as trade or areas of armed conflict. And I think that all of us, and I hope we'll engage a bit in this during the discussion, is how can we make it remain so. So with that, thank you, tusen takk, and I look forward to the discussion.
Thank you so much, Suerie. I turn now to Felix, who will be talking about innovative financing mechanisms. Please, Felix.
Yes, I'll just be waiting for my slides. And in the meantime, I'd like to apologize to anyone who's heard this talk before. I promise it's the last time I'm giving this talk, and do our best to get this paper out quickly and move on to other issues. Here we are. So as you all know, COVID-19 constituted this kind of global crisis of major medical, social, and economic proportions. And against it, COVAX was created in April 2020. And COVAX was, for those of you who don't know, it's kind of big public-private partnership that had the twofold aim to both accelerate the development and manufacturing of COVID-19 vaccines, but also to guarantee fair and equal vaccine access for every country in the world. So it had two goals. One was about speed, and one was about greater equity. And it was also mostly a creation by Western high-income countries, as well as the Bill and Melinda Gates Foundation and the organizations that led it, which you can see on this slide. Now, COVAX officially came to an end last month, and speaking overall, as we've heard a little bit already, it has had at best mixed success. During the first 2 years of the pandemic, when the global response and the vaccine demand were really at their peak, COVAX purchased and delivered around 1 billion vaccine doses to lower income countries, and it shipped another 860 million doses roundabout, also mostly to low income countries, as we've just seen on Suerie's slides. Thereby, however, it fell short of its target of providing 2 billion vaccine doses by 2021. It didn't bring about the global vaccine equity that it had so frequently promised, and it undermined alternative efforts of working towards vaccine equity at the same time. And so a lot of people have written about COVAX's overall governance and what may have gone well and poorly. But Desmond McNeil and I thought we'd zoom in a little bit on the financing of COVAX. And while most of its financing was simply based on donations from high-income countries, I wanted to briefly speak about 3 forms of blended finance that were also present in COVAX and that are interesting because they set the stage for what's being negotiated today. Firstly, COVAX tried to, so one blended finance mechanism helped COVAX try to attract private donations, and that was a matching fund, and I'll speak really briefly about that. Secondly, then COVAX also borrowed some money from private sector investors by relying on bonds, and I'll speak about this. And then lastly, I'll address various forms of pharma subsidies that were supposed to help COVAX fulfill its mission. And I'll speak about each of these in turn, and then I'll ask what the implications for global health may be. And just to be extra clear, what I mean when I say the word blended finance is that I relate to public sector funds that aim to spur additional private investment for some kind of predefined societal goal. So this is about using public funds to attract or mobilize or catalyze money from the private sector that otherwise would not be there. I also think blended finance can be considered part of this broader search for innovative financing mechanisms that really started around 20 years ago with the Monterey Consensus on financing for development. So let's speak about the first blended financing instrument. Those are private donations. And COVAX was very keen to attract those through public appeals and praise for private sector donors, but also by using a matching fund. And as part of that, in June 2020, the Gates Foundation, the Netherlands, and the UK pledged a total of $155 million to match contributions from private organizations and individuals for 5 years. And such attempts to catalyze private donations remain really popular until today. So for example, as debates arose as to where to house the new pandemic fund in 2021, one of the key advantages of setting it up as a World Bank intermediary trust fund was that such a trust fund could mix private and public money, which the bank argued made it particularly innovative and flexible. However, for COVAX, the private donations have been relatively negligible, as you can see on the slide. As of June 2023, out of the $16.4 billion given to COVAX, only around about 5% of funding was provided by private sector donors, and the Gates Foundation accounts for 2% thereof. So, without the Gates Foundation, it's just 3%. And so for COVAX, private sector donations, I would argue, remain relatively small. You might want to argue that in absolute terms, these 3 to 5%, that's still a lot of money. But insofar as we are preparing for the next pandemic and are planning for future pandemic responses, I would not want to rely on private sector donations based on what we've seen in COVAX. Let's speak briefly about development bonds. This is a second blended financing instrument that COVAX used to borrow from the private sector. And in order to do that, it uses an entity called the International Finance Facility for Immunization, or in short, IFIM. And IFIM has been borrowing money for Gavi since 2006. It was a brainchild of members of the Gates Foundation and of the British government, created with input from Gavi, Goldman Sachs, and the World Bank. And it's based on the initial economic work of the Nobel Prize-winning economist Michael Kramer. And essentially, donors can just, in theory, donors can just give money to Gavi, which is what they do most of the time. However, in order to have more money right away, and in order to lock in aid commitments over time, IFM instead asks donors to make irrevocable, legally binding pledges to provide it with aid for several years in the future. And on average, such pledges promise money to IFM for the next 11 years or so. Against these pledges, IFM, with the help of the World Bank, then issues bonds right away and sells these to investors, and thereby it borrows a larger amount which it can give to Gavi right away. Investors hold the bonds for an average of 3 years. They receive an annual interest during this time, and once the bonds reach maturity, the investors give them back, and as with all bonds, you get your initial bond payments back. And of course, you hang on to the interest payments that you've gotten in the meantime. Now, this works much like other bonds, with the exception that it is all paid for by public sector donors, which you can see on this slide. Now, IFM is crucial for Gavi's marketing efforts, as it has over the past 16 years funded around 20% of Gavi's vaccination work. And overall, it has borrowed close to $9 billion from global capital markets so far. IFM has also expanded its mandate over time. So in 2019, it began borrowing for CEPI, turning it from a financing vehicle initially created for low-income settings into one to fund global health commons, if you will. And then in May 2021, IFM began funding COVAX's vaccine development and procurement efforts, and it borrowed around about $1.75 billion for that purpose between July 2020 and April 2021. And its logic is now being promoted, expanded, and complicated further because for the future, Gavi aims to allow IFM to raise funds for the next pandemic by pre-positioning donor commitments to IFM today and only activating or triggering them if and when a future pandemic occurs. So now this, IFM continues and a triggering mechanism is now apparently being built into it. Gavi's marketing also remains aggressive around IFM, asking, for example, why are there not many more IFMs in the world given all the financial needs that we have? All that said, borrowing from the private sector through a special purpose vehicle like IFM is very expensive. And one recent analysis added up IFM's interest payments and overhead costs from 2006 and 2019 until 2019, arguing that these costs amounted to roughly 30% of donor payments and roughly 30% of the disbursements that IFM had made over the same period. And Desmond and I are updating these numbers for our current publication. But to me, these really high costs are not very shocking because if you look at IFM more closely, it's a very complicated mechanism. And it's also not shocking given how expensive other forms of bond-based financing can be, notably the World Bank's previous pandemic emergency financing facility. Lastly, I really wanted to briefly speak about subsidies. COVAX, of course, subsidized the pharmaceutical industry, consistently arguing that a major problem for pandemic PPR is that pharmaceutical companies are too risk-averse. Right? They do not want to increase investments in essential products, and so if we want to counter pandemics, we need to encourage corporate investment. We don't necessarily need to invest into public health systems or WASH efforts, for example. So in other words, pandemic risk is best understood as an extension of corporate investment risk in the vaccine sector. And such corporate investment risks can be reduced through two kinds of subsidies. Firstly, COVAX advocates for push subsidies, that is to say money to boost pharma R&D and manufacturing. And secondly, early COVAX documents also argued that pharma companies needed pull subsidies to improve vaccine demand. So for example, you guarantee that you're going to buy a certain volume of vaccines in the future before these vaccines even exist or are licensed. And such pull subsidies are called advanced market commitments, or AMCs, and they are the reason why the purchasing club within COVAX was called the Gavi COVAX AMC. Now AMCs oh no, sorry, I'm so sorry. AMCs are the brainchild of Nobel Prize-winning economist Michael Kramer. IFM was the brainchild of the Gates Foundation, I apologize. And they were made practically implementable in global health with the help from the Center for Global Development in 2005, supported by the Gates Foundation and the World Bank. And then they were first used by Gavi, which ran the pneumococcal AMC, famously from 2007 until 2020. And from their outset, AMCs have been presented as an alternative to, rather than complementing, weakening intellectual property rights in pandemic times. And so I think we should today have a debate as to when and under which conditions corporate subsidies to the pharmaceutical industry were a good idea in early 2020 when COVAX was created, because at that time, major pharmaceutical companies had underinvested in R&D for years. Global vaccine demand lay at a whopping 7 to 14 billion doses. Most major vaccine manufacturers were already investing billions into vaccine R&D, and alternative subsidies were also in place, notably Operation Warp Speed and subsidies from the German government, for example. But that's not a discussion that we had during the crisis, and it also doesn't seem to be one that many of the institutions in charge seem to want to have today. What happened instead was we divided up COVAX's $16.4 billion, mostly giving it to CEPI and Gavi. And CEPI, of course, provided push subsidies, whilst Gavi oversaw buying vaccines and was therefore responsible for APAs and potential pull subsidies. However, it remains largely unknown how these funds were used, and that's because neither COVAX nor its leading organizations have published detailed spending reports. COVAX's umbrella organization, ACT-A, only publishes regular fundraising calls, known as investment cases, and a commitment tracker, which states how much money comes in against self-declared funding gaps. CEPI's annual reports also do not disaggregate its $1.3 billion in COVID-related R&D support by company, and neither do Gavi's annual financial reports disaggregate disbursements by company or by service provided. Neither have Gavi or UNICEF disclosed systematically what kind of volume guarantees or additional concessions COVAX had to make when buying vaccines. Neither are Gavi or CEPI outlining what corporate transparency requirements or price controls, for example, they would favor, which they often promise in documents, but then these promises were forgotten during the outbreak. Regardless, CEPI is today asking for an additional $3.5 billion for future pharmaceutical support, while Gavi already argues that regionalizing African vaccine production will need a new AMC and additional pull subsidies in the future. So in conclusion, I believe we should have an open, critical discussion as to whether blended financing has delivered in global health. In COVAX, even with a matching fund, private sector donations to pandemic response remained negligible. And when you question IFM borrowing or the Gavi approach of these kind of non-string attached pharma subsidies, the usual response you get back is that it's all really cost effective because vaccines have this huge social value, right? Not only do they save lives, but they're also great for any country's GDP. However, given that we're talking about tens of billions of dollars in public money, and that COVID-19 has created several vaccine billionaires, including from companies supported by Gavi and CEPI, greater transparency would be a first fantastic step into the right direction. And it's only when we know what public money goes where that we can really have a debate about what blended finance instruments actually can or cannot deliver. Thank you very much.
Thank you so much, Felix. Now we're going to hear from Sakiko, who is asking very interesting questions. I'd love to hear the answer now. It's why national governments do not use their policy space to expand access to medicines. But before Sakiko starts her presentation, I'd like to invite everyone to start thinking about questions. We will have quite a lot of time after Sakiko's presentation to discuss. So please post questions in a Q&A if you're online, or note them down on your notepads if you're in the room. Sakiko, your turn.
Thank you very much. Can you see this? I don't know. There's something. Anyway, well, there's a paradox in the debate about access to medicines. I mean, all of the discussion focuses on trying to make sure that international norms, the rules, relax patent rights and other intellectual properties. And an enormous amount of political effort has been invested in those efforts and continues to do so, including during COVID on the vaccine waiver. And as we heard from Deb just now, in embedding those relaxation of rights in the pandemic treaty and negotiating even right now the extension of the waiver onto treatment and diagnostics and so forth. But in fact, the TRIPS agreement, contrary to what we think of it as this terrible thing, is quite a different document. I mean, it creates valuable policy space for low middle income countries to pursue public interest, including not just access to medicines, but also access to technologies in general. And the point about this is that we have to understand that the intellectual property as a public policy tool is not there in order to protect private property, but it is there as a social policy tool to benefit society. And the TRIPS agreement actually recognizes this very clearly. And if you go to the WTO website, it makes this quite clear. And Article 7 makes that quite clear. Article 8 talks about the protection of public interest to prevent abuse by IP holders. All of this was reaffirmed by the 2001 Doha Declaration, and the original TRIPS declaration includes all kinds of flexibilities that allow national governments to use the TRIPS agreement framework as a public interest policy tool. The 2001 Doha Declaration merely reaffirmed what is already in the TRIPS agreement. And included in these flexibilities are LDC, least developed countries specific extension for implementing compliance with the requirements of the TRIPS agreement for intellectual property. And it also includes very specific undertakings for high-income countries or developed countries to promote technology transfer and provide technical assistance. But the irony is that there's very little use made by the lower middle income countries of these provisions. So you sort of ask yourself, well, I mean, if you can issue compulsory licenses, why did you need a TRIPS waiver? So, you know, there has been, it is not true to say that they never use compulsory licenses. They do, and it's been significant, but really quite limited. And then in the, as I mentioned, there's this emphasis on negotiating the waiver rather than on using the flexibilities. And then I am a member of the Committee on Development Policy of the UN. Actually, this work is part of that committee's work. That the graduation impact assessment of LDCs, when LDCs graduate from the status of least developed country category, we undertake an impact assessment of what that graduation would involve, including the loss of all of these preferential benefits, preferential measures, including this, you know, basically exemption from being adopting TRIPS. And in fact, out of the 16 countries under preparation, I mean, it's astonishing. There's no impact of losing that possibility of not being TRIPS compliant because they don't actually use this. They haven't been using it. But the real irony is that the US and other high-income countries make generous use of these flexibilities. So, like in March 2020, the governments of Germany, France, and also Chile, middle-income country, passed legislation proactively to facilitate the issuing of compulsory license for COVID-19 countermeasures. Because national legislation can be made to sort of like to make it easier for government to do this. The government of Israel actually issued compulsory licensing for treatment drugs. And outside of the COVID context, the US makes extensive use of this thing called Federal Acquisition Regulation 52227 for government procurement and government use that effectively overrides overrides patents. And in fact, the idea of government procurement for government use over being kind of a practice in law to whereby you can override patents, ignore patents, is extensively used. I mean, there's a work being done by KEI, an NGO, that's documenting all of this. And I was so kind of horrified by this, and I actually, when I went to interview the head of intellectual property at the WTO, I said to him, what is this all about? He said, oh, yeah, this is all absolutely true. And, compulsory licensing, overriding patents for government procurement, government use, that is established practice in intellectual property law. I mean, this is not, I'm not making this up. I'm really was so horrified to hear this, amazed. I'm sure some of you knew this already, but I certainly didn't after, working on being familiar with some of this literature for many years. So, you sort of wonder why it is that you see the irony of Germany, the leading opponent of TRIPS waiver, doing exactly the contrary to what they did domestically. This is just a chart of the use of compulsory licensing by countries. It just shows you the numbers. And this is just reminding you of exactly what the purpose of IPRs is as a social policy tool. It does serve two public objectives: to incentivize innovation and to promote dissemination of technological progress for the benefit of population. I think we just have to keep this in our heads, that this is really what governments use IPRs as a public policy tool for. Now the and this is this is the text of what is in the article. But basically, the whole point about my paper is to look at TRIPS as an implementation failure, right? So much of our analysis and our advocacy and our public debates go to finding fault in the rules. But there is another huge failure, which is implementing the policy space that already exists and that actually was hard-won policy space negotiated over many years. I mean, debates about the developing countries' demands for looser IP regimes in international trade date back to the GATT. It was a major issue in the TRIPS negotiations, of course, and these provisions for flexibilities. And so, I mean, they worked very hard putting those flexibilities in place. So why don't they use them? Okay. So now why do they? Well, you could say, well, maybe because it's not worth using them, but a lot of studies of empirical experience of using compulsory licensing also show that governments manage to reduce the cost of procurement of medicines and things of that kind. Obviously, the developed countries, the US, Germany, sort of also find use of compulsory licensing pretty useful because they do it all the time. So the usual explanation is, oh, you know, low middle income countries don't know how to do it, or they're ignorant. Well, there is something to that, in a sense that the IP offices of low middle income countries are kind of ill-informed about the way of using this. Maybe they also don't know the possibilities, the potential of using compulsory licensing to, or not being part of TRIPS in order to reverse engineer and acquire technologies, which is really an important objective for many developing country governments in areas of, you know, industrial policies, for, you know, S&T development and so forth. But the practical obstacle is often incompatible national legal frameworks. Some of these countries, Carolyn Deere wrote a wonderful book published, I think, about 2014, on, or maybe even earlier, the implementation game, where she sort of really looks very carefully at why it is that they're at the politics of implementation in the TRIPS, post-TRIPS. And you know, when I read the book, I said, well, why am I doing this paper? It's the same thing, you know, maybe things haven't changed. But I think things have changed, and I do a slightly different take on it. But she points out that, you know, many countries very kind of eclectically, there's no pattern to it. Many countries started implementing TRIPS compliant legal frameworks, even though they ahead of the deadline. In the case of LDCs, it's now 2030, and it's probably going to be extended further. So, you know, many of these countries have legal frameworks that lack provisions for use of, for example, compulsory licensing. They also have provisions in legal frameworks that make it extraordinarily complex, like Dominican Republic tried to do something and it was just impossible because of the procedures. The US can do it very easily because they have a much simplified procedure. The European Union has on the books now a proposal to unify European Union intellectual property law, including a chapter on compulsory licensing, so that the issuing of compulsory licensing will be easier. So all these developed country governments are highly aware of the benefits of this instrument, but this is such a contrast to the narrative, right, that we hear from Big Pharma and the Chamber of Commerce and so forth when you talk about compulsory licensing as this absolutely irresponsible practice that would destroy the innovation system. The fourth real pressure is political pressure. You know, you have retaliatory trade sanctions and things of that kind. Now, I've got 2 minutes to just go through the rest, sorry. So this is the most important part of the paper, which is the analysis, which is to say that there are 4 structural obstacles and power asymmetries that are really what's going on, and that is interest, ideology, information, institutions. And that is kind of what you can work with if you want to think about how to deal with this. And so interests and ideology, you know, cannot be combated very easily, but you can have a new kind of a discourse. And of course, there are people, including most people in this room and many others, who have been fighting the ideology and the narrative of the of Germany, etc. But you know, in a way, I think that maybe that discourse is no longer effective. It's the same discourse I heard in 2000 as I hear today in 2024, that it is a charitable issue. You know, I mean, the US and Germany are not issuing compulsory licensing for the purposes of charity because they are poor. But we hear from the NGOs that you need to use compulsory licensing for charity and because countries are poor. No, the US and others are using compulsory licensing because it is in their national interest to meet an emergency. That's a public purpose, and that's what we should say. But they should also understand that this is important not only for a public emergency, but for technological development in the national development strategy. So I think we need to be much more kind of like hard-nosed and businesslike in arguing for an alternative discourse. We have information gaps because all of the information that is going into this system, so I beg you to give me 1 more minute, even though I have to stop, is that we have to bust these myths about the awfulness of using compulsory licensing and other flexibilities. And international organizations need to disseminate knowledge. Now, the whole point is that there is virtually no international agency, organization that works on disseminating information about flexibilities. I went to to WIPO and asked them. They said, we do all this technical assistance on this, that, the other, mostly basically how to set up an IP office. And I said, what about flexibilities? And they said, kind of like gulped and said, it's not in our mandate. Our mandate is how to use IP, not how to not use IP. Okay. Anyway. But also it goes into the education of lawyers and other professionals who are in the area of IP, that they need to be given information about the alternative economics of IP. People like Stiglitz have talked about IP in a much broader way, not that it's a kind of a magic bullet. Harder, the stronger IP, more IP, the better for economic growth and innovation. No, it's much more complicated than that, and they need to know that alternative heterodox literature. Institutions, as I've said, there's a lot that needs to be done in terms of breaking silos and things like that. But once again, as far as the global governance of this is concerned, we need to rebalance the institutional support for low middle income countries, of which there is virtually zero support. The only financing for this comes from UNITAID, and it's a very small amount, and much of it is provided by the South Center. And then UNITAID also provides funding for some NGOs that provide this kind of policy analysis and actual technical assistance. Otherwise, it's overwhelmed by very well-resourced technical assistance from WIPO that is simply providing information of the sort of the other side, more IP the better, and also just giving technical assistance for both administration of IP and enforcement. Thank you.
Thank you so much, Sakiko. We now have 33 minutes for discussions. That leaves us quite a bit of time. But in order to engage as many people as possible, I'll do like we did yesterday, which is to collect a few questions. We'll take 3 or 4 at a time, and then we take a round to answer them. And I think, if there are any questions in the room, we can start there. And I encourage everyone to post questions online in the Q&A in the meantime. Tom, and afterwards Remco. No, I don't think so. And please, could you identify yourself, Tom?
Hi, I'm Tom Newmark. I'm a researcher, social anthropologist at SUM, working in Katerini's Global Health Politics Group. This is a question for Deborah, actually, or, well, it could be also for Suerie Moon as well, and maybe more generally, because it's something she mentioned at the end of her talk. There are obviously inequities between lower and middle-income countries. So a country like South Africa is very different to Malawi. And I was wondering if there's anything in the treaty or the discussions that's going on around that talks about technology transfer and exchange and what happens between lower and middle income countries. And I guess the question also to more generally, if other panelists want to answer it, is should we be moving sort of beyond the binaries, like Jashodra said yesterday, between the global north and the global south, and looking more at the kind of inequities in regions as well.
Thank you so much, Tom. Remco.
Thank you. Excellent panel. Learned a lot again. First, I have a question for Suerie. Wonderful, Suerie, to hear a little bit this trend of more regionalization and the promises and pitfalls. There have been, in the literature, has been calls for a more public interest end-to-end ecosystem for research and development. That's not completely new. There has been a call before for a treaty, etc. But with this regionalization and with actually this call for a more equitable ecosystem also calls for regionalization, but with governance that is for the public good rather for the private interest. Also with collective finance and sharing, etc. And of course, IP also has a role there. What is needed to make it indeed, to let it shift to the promise and to avoid the pitfalls in what you explain? I know there's uncertainty, but it's a little bit like looking ahead to make it work. I really look forward to your ideas. And then a question for Felix. You were talking about the bonds and the IFFIs, etc. Has there been evidence that these bonds work? Not only maybe in the global health domain and now with vaccine distribution, but from other public goods areas. I will be interested to refute a little bit these calls that they are cost effective and all the promises, etc.
Anyone else? Yes, Mara, please. And please introduce yourself as well.
Hello, my name is Mara Linden. I'm from Goethe University, Frankfurt. Thank you for these insights from the panel. I have maybe a comment or question to Felix, because I think it was really important to not only point out the inclarity in governance structure of COVAX, but also the financing structure. And I was wondering if that relates to also normalizing the economic language or economic thinking that we can see in other areas as well. And that it becomes this need, or it has a sort of a performativity to it. And then one to Suerie Moon, because I was wondering that you were pointing out really importantly the clinical trials in the Global South. And I was wondering if that relates to an exploitation of bodies in the South, or does it also translate